What's up? Hello. Um, we're in this lovely new environment today, and I'm very excited about it because I have this new microphone and I'm testing it, and this is happening. Today, I'm going to do a little FAQ kind of rapid fire on a lot of the questions I've been getting and some things that people are curious about with my journey with my little bone tumor. Ta-da! We're healing very nicely. Things are coming along well, and I can't complain about recovery process. It's been really smooth. So very, very grateful for that. So let's get started. First question is, Alex, what the heck is going on in your leg? So basically, it's a cyst-like bone tumor. So there's no soft tissue on it. It's basically just like a lesion into the bone that kind of like filled with blood and then like calcified. There's like a calcified shell. Next question is, how long have you had this problem? So this really flared up for me about a year ago. So about April of 2023 is when this started bothering me. So I thought that it was just a shin splint flare up, and turned out that this is what we were dealing with. Next question is, how did they find this bone tumor thing? I was dealing with pain for a really long time, and all of the treatments that we were kind of like trying out weren't really working. And when none of that was responding, we decided to take it one step further and went to the orthopedic to get some imaging done, and that's when it popped up. The next question is, Alex, why didn't you like escalate it sooner, or why did it take so long for you to get imaging or things like that? Well, the answer is because some of the treatments that we were trying seemed like they were kind of working a little bit. So we would like try something and it would kind of seem like it was helping, and then it kind of wouldn't. And then we would kind of try something else and it seemed to work maybe a little bit in a different way, and then it kind of realized that it wasn't really helping all that much. So it was a long period of like trial and error for a lot of things. So could I have gone sooner straight to the orthopedic? Sure. But hindsight's 2020. Another common question I get is, what causes something like this? So my orthopedic doctor, who is the orthopedic oncologist, said that things like this are typically caused by like an acute event. So think about like if you were to like slam your shin on like the side of a rock, or like, you know, hit your leg with a scooter or something, and then that causes the body to kind of have this like reaction that makes it like, it's almost kind of like a healing response in a way that just kind of like goes really wonky. So it is something that is actually like pretty rare, especially for the fact that I can't think of anything that particularly like caused the event. We got the microphones charged. So is this benign? Yes, it is, thank goodness. So after all the imaging, they wanted me to get a biopsy procedure so they could test the tissue and see if there are any cancerous cells, because the CT scan showed that I potentially have a rare form of bone cancer. So I got the biopsy done, and there was actually no soft tissue in the lesion at all, which was great news. So basically we've come to the conclusion that it is benign, and there's no cancerous cells. So thank goodness. So what does the removal process look like, and why is that what we decided on? So basically there's two courses of action that we could have taken. We could either remove it, or we can just watch and wait. So since I've been dealing with this for over a year at this point, I was like, hey, listen, we've been watching and waiting for about a year. So let's get the sucker out of there. So my amazing surgeon, basically what he did is he cut my leg open and basically drilled into the bone and like scooped out like the whole like lesion thing, drilled into the bone, and then did a like bone graft, and then stitched me up, and I'm on my way. So what does the recovery look like? So I didn't really know what to expect. So obviously, as this is kind of a rare thing that happens, and also my surgeon said that usually when he sees things like this, it's on like the inside of the bone, and mine was just on the surface of the bone. So that was good news for the surgery, but also for the recovery. But I also really didn't know what to expect. He was like, hey, you are going to be able to walk on it as you can comfortably. So that was just up to me. There was no restrictions on how long I was not able to weight bear or anything like that. So I didn't know. I was like, am I not going to be walking for days, weeks? I had literally no idea. So I was kind of flying blind into it. My only restrictions were, one, just walk as pain would allow me to. And then my only restrictions are I'm not allowed to do any kind of high impact or any kind of sports until at least 3 months. And basically that's just because the integrity of my tibia bone is in a weakened state right now. So it's susceptible to fracture. So I can't really do anything that is like quick change of directions or really high impact. So I'm able to just walk and do as much low impact as I'm able to. So how is recovery going? It's actually been going really, really, really well. And I'm so lucky and I'm so thankful. And I've also put in a lot of work to get to this point, both physically and mentally. So recovery, basically I was non-weight bearing for about 2 days, 2 to 3 days. Then like around the third or fourth day, I was starting to bear a little bit of weight, but still mostly on crutches. By day 5, I think I was trying to be off crutches as much as possible, but I was pretty well hobbling around. And then basically, gosh, by like 10 to 14 days, I was not on crutches at all and walking. I was walking kind of in like a shuffle kind of a state kind of a thing. So now I'm at day 18 and I'm pretty much walking normally, and that's my focus right now for kind of this week basically in recovery is just restoring that normal walking gait so I can get back to walking normally, retraining my brain to walk properly, and not be like limping or shuffling or compromising, you know, my walk in any way. It's been going really well. I haven't needed to take any of the heavy, hard painkillers, which has been great. I'm in a really great spot mentally, which is amazing, and I think that's really helped me heal physically a lot faster. Just being in a good mindset, being not just seeing it as like something that I have to, you know, wait X amount of weeks to be able to do anything again. I'm doing everything that I possibly can. And just been pushing myself a little bit, because for me it is just a comfort and a pain thing. Those are pretty much the questions that I get on a day-to-day basis. Things are going well. I have a follow-up appointment this week with my surgeon to see how things are going. So catch an update on that probably in the next vlog. So if you have any other questions, feel free, leave them in the comments below, and I'll get back to you. And let me know, are you dealing with something like this too? Let me know how I can help you, how I can support you. Guide you in any direction, or provide any kind of support or guidance based off of everything that I've learned through this experience. So appreciate you all, appreciate everyone for the support, and just so grateful for pretty much everything. So that's all I have for this time.